The only people in the room are my videographer and my patient and myself. Today is January 15th, 2022. I've already washed my hands upon entering the room. Is it okay if I assist you and look you over and ask you a few questions?
Yes, it is.
Okay, my name is Natasha and I'm from the University of Memphis. I'm a nurse practitioner student. As I go through the skin assessment, I'm going to be looking at each system for the color, temperature, moisture, texture, edema, turgor, scars, lesions, nevias, and bruising. As I assess her head's in midline, it's proportional to her body, it's symmetrical. As I look through her hair and palpate, I'm looking for hair distribution, color, texture, depressions, tenderness, is this sort all, masses, lesions, and infestations. I'm going to now palpate her temporal arteries. Is this painful at all?
No.
Okay, and I'm going to palpate her lymph nodes. This is the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, the submental, the anterior cervical, the posterior cervical, and the supraclavicular. Now I'm going to ask you to smile, purse your lips, puff your cheeks, frown, raise your eyebrows. That's checking cranial nerve 7. Now I'm going to can you clench your jaw for me? The messenger muscle, is that tender at all?
Mm-hmm.
Okay, and then I'm going to do some light touches. Can you feel this?
Mm-hmm.
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 That's checking cranial nerve 5. And then I'm also going to have you can open your eyes now, and I'm going to have you bite down again, move your jaw side to side. I'm checking the TMJ for subluxation. Is that painful at all?
No.
Okay, I'm going to go ahead and do her light sense on her extremities. Can you feel that?
Mm-hmm.
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 Can you feel this?
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 Mm-hmm.
Okay. When I look at her ears, they're in midline of her body. They're symmetrical. I'm going to palpate the penny and the tragus for any tenderness or masses. Does this hurt at all?
No.
Okay. I'm going to look inside each ear at her tympanic membrane. Okay, and both are clear without redness or exudate. Now I'm going to do the Weber's neuron, which is cranial nerve 8. Let me know when you can, when you lose the hearing of the vibration.
Okay. Now.
Okay, and again on this side,
Now.
and again.
Now.
Okay, and I'm going to go on and do the vibration over the ulnar and the medial malleus. Tell me when you
No.
lose the vibration.
Now.
Okay, and again on this.
Now. Now.
Okay. As I look at her, I'm inspecting her eyebrows, eyelashes, and palpable fissures. I'm looking at her conjunctiva and sclera for any lesions, discharge, drainage. And then I'm going to have her with corrective lenses. Can you cover your left eye for me? Okay, can you read the lowest line that you can read?
BEFPOTEO.
Okay, and can you cover your right eye and do the same for me?
BEFPOTEC.
Okay, and she has 20/20 with corrective vision. Now can you remove your glasses for just a second? Okay, her eyes are pearly. You gonna put your glasses back on? Okay, now I'm gonna ask you to follow my finger with just your eyes. Okay, and now I want you to tell me when you can see my finger.
Now. 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 Now.
Okay, and I'm going to do my red eye study, which I don't have the bright light, but I would use it, and I would look at her eyes for red eye reflex. Okay, as now I'm going to ask you to, can you take your fingers and go like this for me? Okay, can you flip-flop your hands for me? Okay, can you put your finger to my finger? Okay, and I'm going to go ahead and do the strychnosis and the graphisia. Can you close your eyes for me? Okay, can you use your palms out? Okay, tell me what number I wrote on your hand.
8,
And again?
8,
Okay, and tell me what object is in this hand.
a key,
Okay, and again over here.
a coin,
Okay. And then when I was doing her vision and acuity and accommodation and peripheral vision, that was checking cranial nerves 2, 3, 4, and 6. And then I'm going to go ahead and look at her nose. Her nose is in the midline. Can you remove your glasses for one more second? And tell me if this is tender.
no,
I'm palpating her frontal and maxillary sinuses. Okay, you can put them back on. Now I'm going to look at each nerve for patency. Okay, and her nerves are patent. Now I'm going to have you open your mouth for me. And I'm looking inside at the buccal, the palate, the tongue, the teeth, the pharynx, the posterior pharynx, the tonsils, the salivatory glands. Everything looks normal. Can you say "ah" for me? So her tongue, her soft palate and uvula rises with phonotation, which is cranial nerves 9 and 10, and her tongue is in midline without fasciculations, and that's checking cranial nerve 12. Can you shrug your shoulders for me? Okay, and that's checking cranial nerve 11. Then I'm going to look at her throat. Her throat's in midline. I'm going to palpate also her thyroid. Can you swallow for me? Okay, and I don't feel any nodules, and her throat's in midline. And then I'm going to palpate for carotid pulses. And I'm going to listen for any bruise of the carotids. Okay. Now I'm going to have her turn around for me. And I'm going to look at her chest for, palpate for symmetry, rise and fall on both even, which it looks symmetrical to me. There's no signs of any kind of labored respirations, no use of accessory muscles or rapid respirations. I'm going to listen to her lung sounds now. Breathe in and out for me. Okay. Okay. Good. Okay. Now I'm going to percuss in between each intercostal space. And I'm going to check for tactile fremitus. So can you say 99?
99,
Again?
99,
Again?
99, 99, 99.
Okay, and now I'm going to do the bronchophony, the echophony, and the whisper pectorali. So if you would, I want you to say E for me.
E, 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 E.
Okay, and then I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, can you whisper 99 for me? Okay, and I'm going to percuss for CV tenderness. Is that tender at all?
No.
Okay, you can turn around for me. Okay, and again, I see no signs of labor respirations. She's breathing normal, no use of accessory muscles, and her lung expansion is symmetrical, bilateral. I'm going to listen to her lung sounds in the front. Big deep breaths in and out. Okay. And then I'm going to listen to her heart in all 5 spaces, starting on the left second intercostal space with the aortic, the right intercostal second space with the pulmonic, third intercostal space, which is herbs, the fourth intercostal space, which is the tricuspid, and the fifth mid-clavicular, which is the mitral. And again, I'm going to listen to heart sounds using the bell. So aortic, pulmonic, herbs, tricuspid, and mitral. Now I'm going to feel for the PMI. Okay, and now I'm going to listen for 1 minute at the apical pulse. Okay, her rhythm is regular. Her rate is 60. Okay, and now I am going to have you lie down. And as she's lying down, I'm looking for a JVD, and hers is less than 30. I'm looking for also heaves and lifts, which I don't appear to see any. Now I'm going to palpate for thrills at all 5 of the heart points. So the aortic, the pulmonic, the herbs, the tricuspid, and then the mitral. And then now I'm going to re-listen to her heart sounds using the diaphragm and bell. So aortic, pulmonic, herbs, tricuspid, and the mitral. And now aortic, pulmonic, herbs, tricuspid, and the mitral. Now I'm also going to look at her abdomen, and it seems symmetrical. There don't seem to be any indurations or any kind of abnormality with her abdomen. I'm going to go ahead and listen to the aorta for any kind of bruise. And then the renal arteries, the iliac arteries, and then the femoral arteries for any kind of bruise. And then I'm going to listen to my bowel sounds in all 4 quadrants. And then I'm going to percuss the abdomen for any kind of tympany, flatness, or dullness. Okay, and now I'm going to feel for any tenderness or mysis. You just let me know if any of this hurts.
No.
Okay, and now I'm going to palpate for the spleen and the liver. So the liver, can you take a deep breath in and hold? Okay, and the spleen. Okay. All right, you can sit back up now. All right. And now I am looking at her fingers. And her fingers seem to be warm and normal in color, no abnormalities, no deformities, no crepitus. Her capillary refills are less than 30 seconds. I'm feeling for her radial pulses, which are normal. And then I'm going to get you to extend, flex, hyperflexion, okay? And then I want you to abduct and adduct and rotate of the thumb rotation, okay? And now we're looking at her wrist. Her wrists also have no abnormalities and feel warm. So on her wrist, we're going to do extend, flex, hyperextend, and then we're going to do ulnar deviation, radar deviation, and then just rotation. Okay? Can you push for me? Can you pull against me? Okay. Now we're looking at her elbows, which also seem normal. No deformities. They feel warm. I need you to extend, hyperextend, and flex on your arms. Okay, her elbows seem to be normal. Then we're gonna go up into her shoulders. Her shoulders also seem normal. She does have a scar on this right shoulder from previous surgery. Can you push against me? Can you pull against me? Okay. And so the shoulders, we're gonna do extension, flexion, hyperextension, abduction, adduction, internal, external rotation, and circumflexion. Okay, perfect. And then I'm also gonna do my reflexes. So we're gonna do the radial, okay, brachial radial. Okay, we're gonna do the biceps, the triceps, the patellar, the Achilles, and the Barbinskis. Okay, and her reflexes seem to be intact. And then we are going to now do her toes. Her toes, her capillary refills are less than 3 seconds. Her toes look normal. No abnormalities, no deformities, no crepitus, no edema, no swelling. We want you to flex, extend, hyperextend, and then I want you to do, that's it. And then I want you to abduct and abduct your toes. Okay, and now I'm going to feel for the posterior tibial and pedal pulses, or dorsalis pedis, I'm sorry. And both are normal and present. Okay, now I'm going to have you push against me with your feet, pull against me with your feet. Next is her ankles. Her ankles look normal. They also feel warm, no deformities. I'm going to get you to plantar flexion, dorsiflexion, inversion, eversion, and rotation with those. Okay, can you push against me with your legs and pull against me? Okay, and next we're going to go to her knees. Her knees also look normal, no deformities, and are warm to touch. We're going to do her extension with those when she stands up, but everything looks normal with those. Okay, can you stand up for me? Okay, let's go ahead and do the knees. Can you extend, hyperextend, and flex? Okay. Now we're going to go to her hips, and on her hips, we're going to get you to extend, hyperextend, flex, abduct, adduct, internal, external rotation, and circumflexion. And then we're going to do your spine. When I'm looking at her spine, there's no signs of scoliosis. We're doing on the spine, we do the flexion, extension, flexion, hyperextension, lateral flexion, and rotation. So her back looks fine. It looks like she can move everything fine. Okay. Now, we're gonna do the Romberg's test. Can you hold your hands to your side and close your eyes? Okay, I don't see any kind of swing or anything with that test. Can you also hop on one foot? Okay, and then can you walk to that way and back? And her walk is regular and tandem. Thank you.